Good morning, everyone, and welcome to our Healthy Northeast Ohio webinar for Geauga County. We are going to go ahead and get started. So we first want to thank you all for joining us. We are very excited to be partnering with Geauga County, and we look forward to this opportunity to present a little bit more information to all of you about the Health Ohio platform and our efforts with our regional partners. We are going to begin with a couple of housekeeping items. Some of you may be familiar with the webinar platform already, and for today's event, everybody's lines have been muted. We are also recording this event, so this will be shared and sent out after our event is over today. We do encourage questions and feedback. Questions, feedback, any comments that you have as Sarah and I are discussing, we would love to hear any of that. So we encourage that through our chat function, which if you see on this slide, your screen should also look similar with the chat function being available in the lower right-hand corner of your screen. And please do address those questions and comments to everyone or all panelists. We will do some quick introductions before we get going with our agenda. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, Ohio. And Sarah, would you like to come off of mute to introduce yourself?
Thanks, Libby. Good morning, everyone. Thanks for joining us today. My name is Sarah Zabo, and I am a data analyst at the Geauga County Board of Health, and I serve as the data analyst and a website administrator for Healthy Northeast Ohio. So welcome.
Thanks, Sarah. And then if everyone in the audience, if you wouldn't mind adding your name and where you work to the chat, that would be great too. Another way for us to engage in this virtual space, so we appreciate that. Our agenda for today is robust, but we are excited to bring all of this content to you. So we are going to start things off with a high-level overview of our website. We'll share a little bit about our efforts. You will hear from Sarah about all things data. We will both be sharing some resources and tools that you can use that are available through the platform. We will share some additional features, and then we will be sure to leave plenty of time at the end, for questions. But again, we do encourage those throughout this session as well. As for objectives, we are going to be looking at our county level data specifically for Geauga County. We will show you how to build custom reports and dashboards through the platform. We are going to talk all about the resources that you can access and how to search some of our databases as well. And here is a little bit of background information about Healthy Northeast Ohio if you're unfamiliar with us. If you have joined us for a webinar before, you may have heard this, but again, we just want to make sure that we share this for those who are new. So the healthyneo.org site did launch publicly at the end of 2019. We utilize the Conduent HCI web-based platform if you're familiar with that vendor. We have a publicly available site that serves as a population health data repository, and the site, as you'll see later, has over 275 health and quality of life indicators, and this comes from over 30 different reputable data sources. And the great thing about the data repository is that we have this data available at various geographic levels, which can really help in getting very granular with data searches. And our partners in the healthcare sectors, public health systems, community-based organizations can all use the site as a resource to support community health improvement efforts. We currently maintain a presence in 9 counties. This includes Ashland, Ashtabula, Cuyahoga, Lake Lorraine, Medina, Portage, and now Geauga counties. And this work is made possible through a grant from the Health Comp Foundation and through partner contributions. So to all of our supporters, all of our contributors, and we so appreciate your support in our efforts. Before we move on to our official beginning of the website demonstration, we do want to hear from all of you about your familiarity with Healthy NEO. So I'm going to go ahead and open up our first poll, which essentially just asks a little bit about how often you've used Healthy Northeast Ohio before today. So maybe you use it very frequently, maybe you've never seen it before. So I'm going to open that poll, and you should see that option available to you now. So if you wouldn't mind just taking a couple of moments to complete that, that would be great. Oh, and it looks like it was only up for a couple of seconds, so I can go ahead and review those. Okay. All right, thank you, everyone. So we'll make sure that for the next one, we keep that up a little bit longer because I think that that one went a little bit quick. But thanks for bearing with us. So we are going to go ahead and move into our website demonstration. So I'm going to go ahead and pull up our Healthy Northeast Ohio website. Sarah, can you confirm that you're able to see the homepage?
Yep, I'm seeing it, Libby.
Thank you. Thanks so much. So again, this site can be accessed at healthyneo.org. And as you may have seen when I brought this up, there are no special logins or permissions that are required to access the page. And I will just point out a couple of things and a couple of tips and tricks for the homepage that might be helpful, especially if you're new to the site. So the top of the page will remain the same as you navigate through the different pages on the website. A couple of things to note, we do have options in the top left-hand corner to print. You can copy a page as a PDF or you can copy a link to the page. So those are a couple of helpful tools as well. We have many different pages available on the site, so if you get lost and you want to come back to the home page, you can simply click this logo in the top left-hand corner and it will take you back to the home page. The navigation bar at the top will be your best way to navigate through the different pages available on the site. You'll see that Sarah is going to show a lot about the Explore Data tab. In a few moments, I'll be showing you our Geauga County page as we have pages for every county. And we also have tools and resources that we'll both be sharing. And then of course we have a Learn More tab where you can learn about how to use the site. You can learn more about us, our partners, and so forth. So as you navigate through the homepage, you'll see that we highlight different features. There is a search bar that's available if you're looking to search for something by keyword or health topic. We, of course, are featuring a COVID-19 update with a couple of key links to our vaccine ambassador toolkit. We have a COVID-19 resources page, so you can access those here as well. As I showed at the top in the navigation bar, there's a second way that you can access our county pages, and you can do so by clicking any of these buttons. We have a What's New section that we keep updated based on different events. You can see that we were promoting our Geauga County webinar, and we also have a couple of other things that we are currently featuring. We have a data spotlight that is routinely updated. And at the very bottom, you can scroll through to see a list of all of our partners with whom we currently work. So if you were to click on the logo of any of those partners, it would take you to their homepage as well. So next, we're going to visit the Geauga County page. Again, you could do so by clicking on this button or at the very top, based on whatever region you want to look at or whatever county in our region you want to look at, you could click through that way. So I'm going to go to Geauga, and all of the county pages will have a similar layout to the one that you're seeing here. So we do have some overview information. We have a couple of links for health outcomes, county health rankings and roadmaps. And if you continue to scroll on this page, this is where you'll really get into the data and the reports that we have available for that county. So we have our demographics that you can access for Geauga County available here, our socio needs index, all of the other data indicators available, and we have a data scoring tool that you can access through this button as well. And then the second row, you'll see we have the different reports for the improvement plans, implementation strategies, community health assessments, and community health needs assessments. And to give you a little bit of an idea and to just start to look at some of this data that's available, we are going to take a look at the demographics page for Geauga County. We do have over 250 demographic elements that can be viewed here. You can look at all of them by clicking this purple button in the top right, or if you wanted to look through these different variables by topic, you could click through the different tabs at the top here as well. We do have demographics information available at the state, at the county and zip code levels, and you could change the location by clicking this drop-down arrow. And we also can view demographics information at our regional level. And I'm going to just put a pin in that for now because I am going to show one of our other tools for that in just a couple of moments. So as you scroll through this page, this is a really good way to just start off really quickly by showing how dynamic our data visualizations are. So if you were looking to gather information about population by age group for Geauga County, you could do so here. We have a bar graph. If you continue to scroll, you'll see different comparisons to the state, to the region. We have different pie charts that are available. So as you, again, are navigating through the site, you'll see that there is a lot of variety in the data visualizations. And I'm going to point out here, and you'll hear this from Sarah as well, but you can download these graphs and these data visualizations. So in the top right-hand corner, you should see these 3 lines for you to export, and you can download those by as a JPEG, as a PDF, or as a CSV file. So we do encourage that because you can import these into presentations, proposals, reports, and this is available to you. So please do feel free to take note of that feature for your own work. And I'm going to scroll back up to the top, and I am going to take a look at our Healthy Northeast Ohio regional demographics, which is in the form of a story feature. And this is something that we were able to do just last year, which we were really excited about. This is a new feature on the platform, and we received a lot of feedback from our partners who were interested in looking at demographics for the whole region so that we could look at some comparisons and things of that nature. So here you can see, and if you scroll through on the upper right-hand corner here, there's some arrows, but you can look at the population by county and then compared to the whole region. We can look at households and so forth. So again, just a quick feature that we wanted to point out as it was interest to some of our existing partners, and to all of you who are new, this might be something of interest as well. So at the very bottom, I am going to point out a couple of pages in our footer. Again, this section remains the same as you navigate through the site, just like the top does. And this is where we have access to our topic center. So you'll see here we have a couple of different icons. And if you were to click on one of these, this is a quick and easy way to bring together related content. So if you're brand new to the site, not sure where to start, this is a great tip for starting off that search for different data and resources. So for the sake of example, I'm going to go ahead and click on community, and you will see that it has brought together data, resources, toolkits, and many other items on the site that's related to the community topic. So if you wanted to switch that topic, you could just click the drop-down arrow and change that view. Also in our footer, we have a couple of links for contacting us. Again, many of you likely already have our email addresses, but if you wanted to get in touch with us, you could do that here as well. And we also have an FAQ page that's available here. And this is a great feature just in case you're on the site, have a couple of immediate questions. We, of course, are available to you for addressing any questions or concerns. But if you were to click on the FAQ page, it would take you to this page, and you could find things about how to cite data, a lot of common questions that come up as we have individuals searching through the platform. So please do feel free to take a look at that. But again, we are available to you for questions. So with that, I am going to go ahead and turn it back over to Sarah. So Sarah, I'm going to stop sharing and feel free to take it away.
Okay, thanks, Libby. Bear with me for just one moment while I go ahead and share my screen. Libby, can you confirm you're seeing the website?
Yep, I am seeing your indicator list by location.
Okay, perfect. So again, good morning, everyone. And I saw that a lot of people had added your name and organizations to the chat, so thank you so much. So yeah, as Libby shared, I'm going to be spending some time mainly walking through the Explore Data tab on the website just to dig a little bit deeper into showing you how to search for data and then how to create some custom data visualizations, excuse me, using tools on the site, really just to help tell the story of your community. And as Libby shared, the site does centralize population health data, so it allows for various comparisons and then even collaboration across sectors. And data on the site can be used for things like identifying areas of progress and need in your community, setting priorities, goals, or tracking progress, seeing how your community compares to other communities, across the state or even across the country. And then, you could use it for program planning purposes in making funding decisions. So I'm going to start by showing you how to go about searching for data on the website. And just keep in mind there are a couple ways to do this, including the search bar on the homepage that Libby already shared with you. So the first thing I'm going to show is, as Libby said, this is called the indicator list by location. And to navigate to this page, I just went to the Explore Data tab and then indicator list by location. So this is, again, is just another way of looking for data on the website. And if you are a new website user, I would recommend that you do check out this page. Basically, it lists all of the indicators that we do have available on the website, and it also shows the geographic levels of data that are available for those indicators. And as Libby shared, we do have more than 275 health and quality of life indicators that come from those variety of state, national, and other sources. And the majority of the data on the website, I just wanted to mention, is curated and maintained by our vendor, Conduent HCI, with the exception of some local data. So we are able to add local data to the website, and I'll show just a couple of real quick examples of that shortly. But as Libby also kind of alluded to, we do have data at various geographic levels. So we have data for the 9 counties in the Healthy Northeast Ohio region, as well as the municipalities, zip codes, and census tracts that make up those counties. And just keep in mind that availability of the data is going to depend on the source that the data is coming from. And there are a few custom roll-ups on the website. So this sub-state region, I just wanted to point out that that is for the Healthy Northeast Ohio region. So that's going to aggregate all the data for the 9 counties. And then on this page, I'm not going to scroll through the whole thing because it's pretty long. And you can see up at the top, you can also download the list of indicators, but they are organized by topic and then by subtopic. So I'll just scroll a little bit. So if you're interested in looking at data related to cancer, this is kind of just like a quick snapshot of what we have available. And then say, for example, you were interested in looking at like a sub-county level geography, so maybe like data available at the zip code level. Again, this is just an easy way to see, oh, okay, these are the indicators we have available at those levels. So again, I would encourage you to review this list. Again, if you're a new site user, I think it would be really helpful. So another way to search for data that I'm going to walk you through is again in the Explore Data tab, and it's this Search for Data and Curated Dashboards option in the dropdown. So Libby did mention that we have that FAQ page. Up at the top, we recently added this information just to help site users if you do end up using data from the website, just to know how to properly cite it. So feel free to review that the next time you're on the website. But on the search for data page, as you can see here, you can search by keyword. You can use these drop downs to search by a specific indicator, or you can use this location drop down. So for the sake of example, I was just going to do a keyword search. And I'm going to go ahead and do a keyword search for overdose, given that I saw that addiction is a priority in the Geauga County CHIP. So once you do your keyword search and press enter, you're going to see a list of all of the available and related indicators right here. So if you wanted to say, dig in a little bit deeper, for example, with this age-adjusted death rate due to unintentional poisonings, you could just click on that indicator. And then next, you're going to be prompted to select a location. So again, I'm just going to use the drop-down, and I'm going to go ahead and select Geauga County. Hopefully this page will load quickly. Perfect. Okay, so now you're taken to what is called the indicator detail page. So this is where you can really dig deeper into the indicator and see all of the related information. So up at the top is going to be the indicator name, and then the location you've selected, as well as the most recent measurement period that's available. If you were interested in looking at previous measurement periods, you can see this is a drop down, so you could just go ahead and make your selection there. Sorry. And then next, you're going to see a description of what the indicator is. So this is saying this indicator shows the age-adjusted death rate per 100,000 population due to unintentional poisonings. And then there's also going to be some text just giving context. Why is this indicator important? Just below that, you're going to see the current value for the location that you selected. So we can see Geauga County's value here, as well as information about the source, the measurement period, who maintains the data, when it was last updated. And then over to the right, you're going to see a variety of comparisons. So any comparisons that are available for that particular indicator are going to show here. And I will acknowledge that the website does use a variety of colors and these gauges and dials and icons. So just a few tips. One, if you hover over one of the comparisons, you're going to see this box pop up that'll give some more information to help you interpret that. So here we're looking at Geauga County compared to other counties across the state, other counties across the country, and then comparing Geauga County's value to the state value as well as the US value, looking at how this value might be changing over time. And then another tip over on the left side of my screen, if you can see in blue here, this see the legend, all I did was just click on it and it pops out. But up at the top, this just gives you some information about the color coding that's used on the website. And then again, just a very quick description of the variety of gauges and dials used. And then you can just click hide the legend again and it'll minimize. And then below those comparisons on the left over here, you're going to see all the indicators should have the change over time graph available to you, but it depends again on the indicator and where that data is coming from, if subgroup data is available. So it looks like for this particular indicator, there is breakout data available by gender. So you can see those graphs. And again, as Libby shared, if you just click this 3-bar symbol, you can easily download those. And then just below that, there's also going to be a map. And you can see there's a tab here. So it's just showing the different geographies that this indicator is available at. So if, say, zip codes were available, you would see an additional tab. And these maps are somewhat interactive. So you can zoom in and zoom out. You can turn labels on or off. You can also change the background, the transparency, and then you can expand it if you want. And just like the graphs, you can download these maps just by clicking Export Map. And then to the right of that, we're just seeing this bar graph showing kind of a comparison of this indicator across our counties. And then at the very bottom of the indicator detail page, you're going to see a table, again, just showing this data. And then you can actually download the data at the very bottom right here where it says download county indicator. And you can download that to a CSV file to use. And then at the very bottom, sort of like the topic center, this is just another way that the website brings together related content on the website. So you can see here that it's showing other indicators that might be of interest to you that are related to this, as well as promising practices, other data resources, and fact sheets. So again, that is just a couple ways to search for data on the website and then how to dig a little bit deeper into a particular indicator. So in addition to those indicators available on the website, I also wanted to share that we do have several specialty dashboards and then a few curated dashboards on the website. And a dashboard is just a collection of indicators around either a topic, a location, or some other element. So I'm going to start by showing you the specialty dashboards on Healthy Northeast Ohio. So Libby already showed you the demographics dashboard, so I will skip that one. But we do also have a disparities dashboard. So if you're interested in looking at differences in health between groups, you could use this dashboard to help identify those groups to, maybe focus your program and or your policy efforts towards. So this dashboard allows you to view indicators that have subgroup data available by race, ethnicity, age, and gender, again, to identify those populations who may be disproportionately impacted. And again, just please keep in mind that this breakout data really just depends on that data source it's coming from. So here, again, there's a drop-down menu, so you could select a particular location, but you can see the overall value for the location you've selected, those comparisons, and then again, whatever breakout data is available. And you'll see that in these graphs, they're going to show the overall value so you can see how the different subgroups might compare. So that is the disparities dashboard. We also have a food insecurity index. So this is actually a newer tool that was created by our vendor, Conduent Healthy Communities Institute. And this is a measure of food accessibility that's calculated using social and economic factors, so things like household expenditures that might impact a household's ability to purchase food. And you can use this to identify areas in your community that are estimated to have the highest food insecurity. So in a nutshell, how this works is that all census tracts, zip codes, and counties are given a national index value. So that's going to range from 0 to 100, with 0 being low need and 100 being high need. Then those national index values for each location in a community are ranked. And the rankings range from 1 to 5, with 1 being low need and 5 being high need. So in the map, the darker the green, the higher the estimated food insecurity. Again, just kind of helping to know where to target efforts. And I did want to point out that just below the map, there's a couple filter options. So say, for example, I wanted to hone in on Geauga County specifically. I selected county, and then I'm going to select Geauga County, and I'll just keep it at the zip code level. I could zoom in a little bit, and just like the other maps, I could turn on the labels if I wanted, make adjustments to the background, and I can even export this map. So again, that's the Food Insecurity Index. Another specialty dashboard that I wanted to show is our Socio-Needs Index. So this is another tool that was created by Conduent HCI that summarizes multiple socioeconomic indicators like poverty and education, and it puts it into one composite score for easier identification of under-resourced areas. And this is again available at the county, zip code, or census tract levels. And again, this works similarly to the Food Insecurity Index in that all of the census tract zip codes and counties are given that national index value ranging from 0 to 100. And then those national index values are ranked from 1 to 5. So in this map, the darker the blue, the higher the need. And you can filter this similarly to the Food Insecurity Index. So again, if I wanted to, I'm working faster than my computer, look at, say, the census tracts in Geauga County, I could make those selections as well. And then the last specialty dashboard I wanted to show is our Healthy People 2030 Progress Tracker. So this progress tracker shows how a location compares to the National Healthy People 2030 10-year objectives for improving the health of all Americans. Again, this has a drop-down, so you can select the location that you're interested in. And the website is still showing, if available, the Healthy People 2020 targets as well as the 2030 targets. But you can use this dashboard to identify needs and priority populations, to help set goals for your programs, and then to compare your community to these national targets. And this dashboard only uses 2 icons, so it's either a green check if the target is being met or a red X if it is not being met. So again, we encourage you to check out all of those specialty dashboards. And then real briefly, I just wanted to mention, as I shared, you can add local data to the website. So keep this in mind. If something pops up that you think others would benefit from, please feel free to reach out to us, and we can definitely make that happen. And we can also create curated dashboards with data that's already existing on the website to kind of bring it together. So we've done that, for example, with ACEs related data and social determinants of health. We also did it with COVID, and then digital access indicators. So these are all curated dashboards just so you can more easily find indicators around specific topics. And then 2 examples of local data. So from the Cuyahoga County 2019 CHNA, we did add some select indicators. And then we also have added Cuyahoga County childhood lead poisoning data. So the next time you're on the website, you can feel free to check out those curated dashboards. Okay, so now that we've looked at how to search for data and then the specialty and curated dashboards, I'm going to show how to create a custom dashboard. So these dashboards will bring the data together into one place. You can use those, to help identify areas of progress or need. They allow you to see a summary of the indicator and then any of those comparisons that are available. And these custom dashboards are dynamic. So as the data on the website is updated, your dashboard automatically is updated. So that's nice. And you can also easily share these with others, which I will show you in just a moment. So this is a sample custom dashboard that I created around mental health indicators for Geauga County, as I saw that mental health was also another priority in the Geauga County SHOP. So you're going to see in this custom dashboard that these are all of the indicators that I've included. So it's going to show the current value in the second column, and then to the far right, any of those comparisons that are available. And these custom dashboards can be viewed in one of two ways. So this is the list view, but if you can see where I'm pointing right here, this kind of stack box icon, if you click that, you can actually see the dashboard in the card view. And I think these cards are really nice because you can save the individual cards and pop those into like a PowerPoint or a document or something you might be working on. But just to very briefly walk you through how you would create a custom dashboard on the website, you would go to the Explore Data tab and then build a customized dashboard. And then this is a drop down up top. So you would just select one or more locations of interest. And to the right, if you use this drop down arrow, there's a map that you can use if you find that easier. And then there's either the handpick indicator or filter indicator option. So right now I'm using the filter indicator option. So this is just using various topic areas. But if I had, specific indicators in mind, to the right, you can see I could toggle to that handpick indicators option. So instead of the drop down being topics, it would be specific indicators. And then once you're done making your selections, as you can see, there's other filters that you can add. You would just click search, and then your custom dashboard would display below. And as I mentioned, these are really easy to share. So if you can see below search results, there's a save a link to this search option. So if you just click on that, a URL will show up, and then you could email that to someone or embed it in a document. So again, I know that was kind of quick, but if you go to use this feature on the site and you need any help, please feel free to reach out to Libby or I. Or as Libby alluded to, in the Learn More drop down on the website on the How to Use the Site page, we do have extra videos and PDFs that can be helpful as well. So I'm going to go ahead and stop sharing, and Libby, I'm going to turn things back over to you.
Thank you, Sarah. That was wonderful. And again, and you put it very nicely as well, but to everyone in the audience and all of our participants today, as site administrators, we do have the capacity to have a lot of freedom with the website, whether it's developing custom pages, developing some of those curated dashboards that Sarah mentioned, and of course, uploading local data if it's a fit. So we do encourage you to reach out, and we are very open to these conversations as well. In true virtual fashion and something we're all accustomed to, I am having some errors and technical difficulties with our second poll. So I will go ahead and just ask it. And if you could go ahead and share your feedback in the chat, that would be great. And then we can move on to the next part of our review of some of our tools and resources. So Sarah just shared a lot about the data, how to access data on the site, and we have a lot of secondary data that's obviously available. So if you wouldn't mind sharing a little bit about how often you use secondary data, that would be great. So if you are someone who uses secondary data all the time in your work efforts, we would love to hear that. If you are someone who perhaps doesn't use secondary data very frequently, once in a while, if you could just drop a quick message in the chat with a couple of words on how often you use secondary data, that great. And no matter how often you use it, we really hope that you feel compelled to now come to Healthy Northeast Ohio as that source for secondary data, or perhaps it's something where it's inspiring you to say, oh, now I know that this is available and I can come to Healthy Northeast Ohio. So I am looking in the chat. I'm seeing a few individuals share, some not often, some frequently, once in a while, very frequently. This is great to see. So thank you all. I know responses are still coming, so we'll give it another moment to let everyone provide their responses. And while everyone is finishing up that response, and thank you again for bearing with us with the technical difficulty, and I'm going to go ahead and get the website shared again on my screen. Okay. Alrighty. And then Sarah, can you confirm that you're seeing the homepage? Thank you. Thanks so much. Okay, so I am going to take the next couple of minutes to review some of the tools and resources. And again, the tools and resources are available under this tab. The first one that I'd like to call your attention to, and the one that we're going to spend a little bit more time in, is our Promising Practices page. And this is a database that is maintained by our site vendor Conduent, and with it you have access to over 2,000 evidence-based practices, effective practices, and good ideas for community health improvement activities. You can learn more about the ranking methodology and everything that goes into their own methodology for that here by clicking that hyperlink. And you also have the option to submit a promising practice. So we know that there's a lot of wonderful work that's being done in Northeast Ohio. So if you are doing something that you think would be a good fit for partners across the nation to hear about, we do encourage you to submit that promising practice here. We would love to see some Northeast Ohio partners be reflected in that as well. So we are going to review this just a little bit. As I mentioned, there's over 2,000 promising practices available here, which is quite to comb through, and I know that that can be an intimidating. So to narrow your search, we are going to suggest to you to use the search filters, and we will walk through this just very briefly. So for the sake of example, I'm going to use addiction as our keyword search. And you can sort by ranking. So if you knew you only wanted to look at evidence-based practices, you could do that. If you had a specific target audience, you could select that one as well. I'm going to go ahead and pick adults, and you can narrow it based on topic and subtopic. One of the really cool features I like about the filter options is that you can select based on geographic type. So if, again, you knew that you were looking only for programs that were for urban populations and urban geographic locations, that would be a good option. But we're going to leave it there for now. And here you can see that it has brought up a page with 15 results rather than the 2,300. So we certainly narrowed it down. And with that, if you knew that you only had a few minutes, or if you wanted to share this with a partner or a coworker, you could save a link to this search to come back to it later. And I'm going to go ahead and show you what one of these programs would look like. So again, there's 15 here, and the one that I'm going to showcase is this Community Outreach Addictions team. And I have it pulled up just in case it was going to be a bit delayed. So here we have the actual page for this promising practice. So you can see a little bit more about the ranking methodology and why it was ranked as a good idea here. There is information about the program, the impact, results. One of the great pieces of this page that I really appreciate is that there's contact information for the entity that submitted it. So if you were, a health department or a hospital program that was looking to do something similar and you wanted to get immediate feedback or talk with somebody who has already implemented this, that information is available in many of these promising practice results as well. And at the very bottom of the page, as Sarah has pointed out, as we talked a little bit about with the topic center, this is another example of how related content is brought together. So based on the program we were looking at, it has brought together indicators that are similar to this one, various resources. We just recently did a Healthy Northeast Ohio webinar that it's brought up for this as well. So again, if you knew that you wanted to keep searching based on the topic related to the program, you could look to the bottom. But if you wanted to continue looking at other promising practices, you could click on this box in the upper right-hand corner, and it has brought together related promising practices to continue on that search. So that's just a couple of things that we wanted to mention about the Promising Practices database. Of course, there's a lot of data on the site, and as you are using it to identify areas of need or areas that your community needs more focus on, this might be a good place to start for examining programs that you might consider implementing in your own community. And I'm going to go ahead and point out a couple of other resources that are available in the Tools and Resources tab. Again, we have our COVID-19 resources, which we mentioned on this page right now. We're featuring just different links to the hospitals and the health departments. We have a couple of data links available here as well. Our Vaccine Ambassador Toolkit is a great tool that we were able to build out in partnership with UH and some other community partners. And this was a great opportunity for us to really work collaboratively to develop a page that was going to meet the needs of the community here. So this is a great area where you can look at information on vaccine hesitancy. And we also have an emergency preparedness resources page, and this includes links, different information, different links to other community and community-based resources. And I accidentally clicked on that, so let me go back really quickly. We have funding opportunities that are available as well. This is maintained by our vendor, and these mostly include national and federal funding announcements. Our promising practices database we did look at. We have 211 resources that are available. So for all of the counties in our region, we do have links and information for their 211. Sarah is going to be talking about building a customized report, which is available in this dropdown as well. And then we also have a community health needs assessment guide, which is a step-by-step toolkit, and it's also developed by our vendor. So that's a great tool for somebody or a community-based organization or anyone who's really looking to start off a community health needs assessment. And the last resource that I'm going to point out is our resource library. We have a robust resource library with over 300, I believe, resources that are available. And this is maintained by Sarah and myself. This includes various reports, presentations, toolkits, site links, other related documents. So by clicking on this icon in the right-hand side of the page, you could expand the filter options. So again, this looks similar to the filters that we just looked at for the Promising Practices database, and this could just be another way to narrow down that search result. We have a search bar at the top as well, so you could search by keyword. And I also want to point out our collection option. So if you knew that you wanted to look for information specifically about health equity or adverse childhood experiences, we have created these collections which bring together all of the resources available related to that topic. So things such as our news and updates, if we have announcements, webinars such as this one will be added to this collection as well. So those resource collections are available as well. If you would like to submit a resource to be added to the resource library, you can do so here. There's a little hyperlink right there. And this goes directly to Sarah and myself. So we will receive that and assess it and eventually get it uploaded to the resource library. And that concludes the review of the tools and resources on my end. And I believe I'm going to go ahead and turn it back over to you, Sarah. Were there any questions in the chat about the resource library or Promising Practices database? I saw the chat, but I didn't open it.
No, you're good, Libby. There have been a couple questions that I've tried responding to. I think one that was specific to the Promising Practices database was just if you click that save a link to the search, like where does it save? And I just shared that you would have to literally copy and paste that link and save it on your end. So you could email it to yourself or put it in a document and save it. So I think that was the only one specific to those. So thanks, Libby.
Great, and thank you all for the questions. I appreciate that. All right, I'll go ahead and turn it back over to you, Sarah, and we are wrapping up here shortly, everyone. So as questions do continue to come up, please feel free to add those to the chat, and we will make sure we do leave a couple of minutes at the end to address any unanswered questions.
Okay, thanks, Libby. So the last resource that we wanted to share is the option to build a custom report on the website. So this is another data-related tool that you can use, and it's called the Location Report Builder. So this is a tool that allows you to build these customized reports based on a particular location and then indicators of interest. And it is a pretty easy way to quickly pull together different components on the site into one document that is a downloadable PDF. So again, you can use these reports to help tell the story of your community. You can share them with others. I did want to mention that these reports are a snapshot in time. So if the data pertaining to the indicators that you included is updated on the website, your report will stay the same. So these are just static PDF type reports, unlike the custom dashboards where if you saved the link to your custom dashboard and returned back to it on a year from now, and the data had been updated, you would see those changes reflected. So again, these are just more of a static type report. And you can use these for a variety of reasons. You could make, for example, a community profile. So we've used this option to create demographics profile reports for each of the counties. You could use it to highlight a particular topic or maybe a priority area. So I made just a quick example just to show you all. And this is a custom report I created using chronic disease related indicators, as that was another priority in the Geauga County CHIP. So as you can see here, I just included 2 indicators, and these can go on to multiple pages. But again, this was just a quick example. So here I've included 2 indicators: adults 20 plus with diabetes, and then adults who experienced coronary heart disease. So I've included the indicator card up here, so showing what the indicator is, the value, and then some comparisons. I've also included text with a description of the indicators as well as the source of where this indicator is coming from. Here I've got this change over time graph and then a map showing Geauga County compared to the other counties in our region. And this one looks sort of similar, and the different components you can add will just depend on each indicator and what's available. So for adults who experienced coronary heart disease, I kind of just kept my look similar, so the top section similar. But here you're going to see I have this graph showing this indicator for all of our counties, and then I have a map here specific to Geauga County. And again, you can customize these, make them look however you wish. So that was more of a finished product, but I did quickly just want to show you all how to go about making one of these reports on the actual site. So if you went to the Tools and Resources tab and then build a custom report in the dropdown, you'd be taken to this page. And your first step is to select a location. So I'll just go ahead and select Geauga County. And then from there, you're going to see your toolbar appear. So we're in edit mode now. So your next step would be to select indicators. So here you could type in all, and then all of the available indicators on the website would show up, or you could do a keyword search. So I'll do chronic disease. And then over on the left here, you're going to see these are different indicators that showed up for my keyword search. So if I picked adults 20 plus with diabetes, like I included in my report, to the right now, you're going to see all of those different components that you can add. And if I hover, it should show a quick example. So these are a couple different charts you could add, some different gauges, and then that indicator card that I had mentioned, different maps that are available, and then different tables, and then these are more like text blocks that you can add. So you would I'll just click on the first one. You would click on one and then just click add, and then it would add those components to your report. And while in edit mode, you can make changes to text. So you can just click this pencil icon, or you can center this, increase the font size, make it a different color. You can delete components by just clicking a green, or excuse me, orange X. You can also drag and drop components. So say I made a mistake and oops, I wanted that up there. You can do that. You can change the size of components just by clicking and dragging. And then to add additional indicators, you just click indicators and follow those same steps. You can see here, you can also add demographics information, a map of the socio needs index, a map of the location. You can even add a legend, which might help those who are interpreting your report. You can add custom text, and then these horizontal and vertical lines if you want to use those to break up your content. You can also look at it in the preview mode if you wanted to see a little bit more of what that finished product would look like. When you're done, you can just click this save icon in the far left of your toolbar, where you can download it as a PDF, or you can save it for later. So it would save this report in your web browser if you weren't done, for example, and you needed to come back to make some tweaks. So again, I know that was brief, but that is the location report builder in a nutshell. So again, if you use this feature and you need any assistance, please don't hesitate to reach out. So I'm going to go ahead and stop sharing, and I'm going to turn things back over to Libby to wrap us up.
Thanks, Sarah. And I'm going to point out before we get back to our PowerPoint, of course, everyone will have this meeting recording available. So for any of these items that we've covered, especially things like building the custom report, if you were looking to go back and remember, oh, how did they do that? You can always go to our Learn More tab, and in the How to Use This Site page, we do have video tutorials. And so I believe we do have one for how to build a custom report that's a little bit longer. So if you wanted more of a one-on-one on how to do that. And of course, we can answer your questions too individually. So just wanted to point those out. We are going to go ahead and start wrapping up. So I'm going to pull up our remaining slides here as we prepare to conclude our event today. An hour flew by. I know we gave you a lot of information and a lot of content this morning. We talked a lot about how to access data, the different data indicators, data sources, how to build dashboards, reports. We looked at some of those resources and promising practices. So we know that that was a lot to cover. So this is just a summary on what we've covered today. And And we do want to mention that Sarah and I are both available for in-depth and tailored presentations. So if you have an organization that you work at that you think multiple individuals would benefit from this information, or you wanted us to really do a deep dive on chronic disease or, smoking and things like that, we are definitely available for tailored presentations. If you even have a coalition that you're on that would benefit from this information, we are very open and available to those opportunities. So this is our summary slide, and I'm going to go ahead and move on to our contact information. And I'll leave this up for just a couple of moments. I know, again, that you can access us through the Contact Us page on the platform, but you can always reach out to us via email or phone, and we are definitely willing to have more conversations, especially if you want to, set up a longer conversation about accessibility for uploading local data and things such as that. We are very available to you. So I'll leave this up for another moment as I wrap up with a couple of announcements and give everyone a chance to add any questions if you have any. Just a couple things to keep in mind. We do have a quarterly newsletter that we distribute, and this includes things about site enhancements. If we have new data that we've been able to add to the site, we will add that there as well. Right now, again, we have over 275 health and quality of life indicators, but as that number fluctuates and as we get access to more data, we want to be sure to share that with our partners as well. This was our first webinar of 2022, and we are definitely looking forward to having more publicly available events, whether it be on specific topics or highlighting the work of our partners. So please do be on the lookout for that, and those will also be shared and promoted in our data dispatch. We are on social media, so if you feel compelled to tweet about us or post about us on LinkedIn or Facebook, we encourage you to use the hashtag HealthyNEO. For some of you who have partnered with us before and been with us for some time, you know that we had 2 regional convenings last year, and we are looking to do about 2 or 3 this year. We do not have a date for the first one, but we will be sharing that information out shortly once we get those plans underway. And I think that was my final announcement housekeeping item. So I'm going to go ahead and go to our final slide just as, again, a thank you. And Sarah, are there any questions that we are getting that are coming through the chat before we officially wrap up?
I am not seeing any additional questions right now, Libby.
Okay, great. We'll give it another moment just in case we have any lingering questions or if anybody is typing. But aside from that, we will go ahead and be sure to wrap up and give you the rest of your morning back. And then Sarah, do you have any final thoughts or feedback before we close out?
I was just going to say, I know a very common question that we get, I could share with everyone is, we typically get asked how often is the data updated on the website? And I will say that most indicators are updated on an annual basis. And once the data becomes available from the source, if it's data that's curated by our vendor, Conduent, they typically have that data up on the website but within 60 to 90 days. So just to keep that in mind. But I'm not seeing
Thank
any
you.
other questions. Yeah,
Great.
thanks everyone so much for joining us.
Yes, thank you. And we look forward to continuing to connect with you. And we thank you again. And to everyone in Geauga County, we welcome you to Healthy Northeast Ohio. Have a great day, everyone.
Bye-bye. Thank you, everyone.